Hi, I'm Haley Thompson, and I'm going to present to you about female sterilization, the tubal ligation. Tubal ligation is one of the most common forms of contraception. Nearly 700,000 women in the U.S. alone actually have the procedure done annually. It's a permanent method of contraception. It involves tying or cutting the fallopian tubes and basically blocking the passageway of the egg in the fallopian tubes. This is ultimately for women only because men don't have fallopian tubes. It's a permanent method. However, the reversal of the procedure is actually becoming more popular. This is a prevention for pregnancy and not STIs, so condom use is very well advised still. According to Planned Parenthood, the procedure can cost anywhere from nothing to $6,000, depending on your insurance that you may have. So a special tool is used during the procedure. It's a small camera with a small light on the end, and it's inserted through an incision in the abdomen. Depending on the physician that you may have, they may use local or light general anesthesia. The procedure takes maybe a half hour or less. The procedure is usually an outpatient procedure, meaning that the woman can actually go home the same day and then start up any regular activities that she does on a daily basis after only a few days. So, like I said before, the fallopian tubes are just basically blocked off so that the egg and the sperm can't come to a meet, and then that prevents pregnancy. There is, however, a less than 1% chance that this method does not work. There's no 100% chance for anything because there could be some kind of issue, poor surgical technique, or some kind of spontaneous reconnection of the fallopian tubes could possibly happen. However, like I said, it's a less than 1% chance. So ultimately, you have a very good chance of not becoming pregnant after you have your tubes tied. The advantage of this form of contraception would definitely be the effective rate that there is. It's nearly 100% effective. You don't have to worry about taking a pill every day at the same time every day. Don't have to remember to go in for your shot every 3 months. So you don't have to remember anything. It's just a permanent procedure. No worries there. So it's definitely a good advantage. I'd say the disadvantage is how permanent it is. I mean, the reversal rate is increasing over the last 20 years. However, with it being permanent, a lot of people advise for you to really think about what you're doing before you actually get the procedure, because the reversal, it's optional, but of course you don't want to go through that when you made the decision to get your tubes tied. I guess since that the reversal is coming in now more recently, the one disadvantage is the fact that it still doesn't help prevent against STIs, so you still do have to use condoms. I would say if one of my friends were interested in this procedure, at my age, I personally would recommend that they look for something else, because like I said, with it being more permanent, at my age, I might say that I don't want kids, and then 10 years down the road, meet somebody, marry them, and then want a family. And then I just have to go through a reversal, which is completely unnecessary if you never have it done at a young age anyways. So if my friend was my age, I definitely tell them to look for something else, whether it be a pill or the implant in your arm or a depot shot, because that's definitely more short term rather than a permanent procedure. So I definitely advise against it at a young age, and definitely think about it, and ultimately talk to your doctor about it. They're definitely more experienced with it, so talking to the doctor and really putting thought into what you're doing is definitely my advice. So like I said, this form of contraception is actually a wonderful form at maybe your 30-year mark. So thank you for watching, and think about your contraception.